So I have my jacket, it says Springfield-Greene County Health Department Jail Diversion Program on it, and I walk around, I wear it every single day. I don't care what the temperature is. I am so proud to wear that jacket and to be part of this community, to be part of the city.
My role in the jail diversion program is to act as a liaison between the judges, the prosecutors, the health department staff to formulate a plan. So once a judge approves the referral to the jail diversion program, then I become involved and submit the referral to the health department. The health department, community health workers, and the coordinator formulate a plan for substance abuse treatment, for mental health treatment, for other barriers in their lives, and we present that plan to the court.
It's more like a hand up versus a hand out. They need somebody that will believe in them and work with them, and that they can trust.
So I've worked for previous organizations, and I would refer people, go here, go there. They can help you over here. The city of Springfield actually has the budget for this to pay for food, to pay for work boots, to pay for shelter. This program is, I've never seen a program like this before.
We really offer an opportunity of perseverance, of reducing barriers, of opening a window of opportunity for them to be able to find a new path.
I come from a lengthy background of drug addiction myself, of 25 years. So to be able to relate to our clients and to help a lot of them has been a very proud thing for me to be part of this program.
The clientele that I worked with, I still have a relationship with the majority of them, and they just need some positivity in their life. They need someone that will be there to support them. Most of them do not have family, so they look at us as their family once we build that and establish that rapport with them.
I had kind of dipped out on my probation for a little while. It was a couple of years. I got to a point where I knew that I needed help, and I turned myself in, and I went to see my probation officer, Jenny. Wonderful person, and we had a conversation and they introduced me to the jail diversion program, and I went into sober living that day.
I had worked a job for a long time and decided to quit it and start my own business. Unfortunately, 2 weeks later, I was in a bad accident that led to about 6 months of recovery. Unfortunately, it took all my funds and all my money. I found myself homeless.
I've been homeless off and on for nearly 20 years or so. The judge just asked me if I was chronically homeless. So that trespassing charge. Well, basically they wrote me into an extra week in jail. But then they introduced me to Angie.
I was arrested through Greene County for an outstanding warrant, traffic ticket. Stood before the judge 2 days later, got to tell him my story, and told him I wanted to pay the traffic ticket. I didn't want to be an outlaw, but unfortunately I just didn't have the means to do it. Most of my days were consumed with where I was going to lay my head that night, what I was going to eat. So the judge deferred, or he referred me to the Greene County Health Department, to the jail diversion program. Didn't know what to expect when I first got there, but I was willing to try anything.
There's a lot of trauma. There's a lot of things there's a lot of obstacles to overcome, and they give you the time and the safe place to do that.
The program got me into a hotel, started me up with a kitchen, got a copy of my birth certificate, seeing doctors about my heart and blood pressure.
I didn't have anything to my name, and within a few weeks, these ladies were able to help me acquire everything that I needed to be productive and to get back on my feet.
They've given me the time to do this. It is a process, and they've been very careful not to stress me out, not to make me feel overwhelmed, and that has been a huge help.
Angie and Jody have been awesome. So this is all there is to it.
Looking forward to holding down a good job, to once again have a vehicle, get back in touch with family, and most of all, maybe give back to the community a little bit, give back to the people that are out there that are really wanting some help and need some help.
There are those moments where you don't see a future, and it's been good to have just the minute to stop and breathe and figure it out.
This is our community. These are our people. Our community helps us. We couldn't do any of this without our community with us.
When the jail diversion team came to us, they asked if we would be willing to partner with them to help their clients get medical care, and we were very excited to be able to participate in that. And so I basically have just assisted Angie and Jody both in helping patients get the medical care that they need and also get connected to community resources.
We feel very humbled and very privileged that we get to meet these individuals where they are, say we're here to help you, we're here to lift you up and help you get on your own 2 feet, and then walk with them through that whole journey. And working with the jail diversion team, I think they had the same mission.
We saw a participant that was very much in need of a lot of medical care and a lot of mental health care as well. And it was really awesome to watch those things get addressed and then to watch him flourish after those things were addressed. So I really appreciate the whole team in recognizing that that impacts people's ability to function in society. Talking
with the judges, there's this idea of, the jail diversion program came out of a idea of wanting to give people a second chance, that we shouldn't judge people based on one poor decision or one poor action. And I think, our ministry works the very same way. Our patients sometimes make mistakes, or sometimes will make decisions that will negatively impact their health, and we will always meet them where they are.
Our job with the jail diversion program is we provide recovery housing, and we do evidence-based treatment for the clients and try to hold them accountable.
I am a house manager at Restoration of Hope. It's given me the opportunity to really get to know a lot of these women and their stories.
That's a big deal because she's not only taking on the accountability that we require in our program, but she's also kind of taken a role in mentoring and holding others accountable in her house. And we're getting ready to move to a bigger house in which she is helping set that up. So she's really taken this on. And it's been nice to see, because our program's tough, and it takes a willing heart, and she's definitely demonstrated that.
Places like these are needed, and for those who really want this opportunity, it's been a great thing.
Bringing them out of the jail, putting them in a program like ours, gives them a chance to be held accountable and gives them a chance to find a different way besides just sitting in a jail doing nothing, which helps no one. And so I feel like the jail diversion program really encompasses a rehabilitative stance versus a punitive, and punitive just never really works, especially when it comes to things like substance use, mental health.
All of our resources are strong on their own, but together, unstoppable.
You sit there and begin to ask them about them instead of the charge, and you kind of just see the stress begin to melt off their shoulders. Will you then be able to hear their story? They trust us enough to tell their story to us. And we just lay out the opportunity of, here are the things that we can help you achieve those, but you're going to have to do the hard work. And I think that this allows us something that we've never been able to do before because we didn't have the funding, and we are truly making an impact, whether somebody leaves the program or chooses not to participate in the beginning. We're making one positive contact each time we offer that help. And I think that truly is going to build the program.
Thank you for being there for me. Thank you for believing in me. And thank you for the helping hand up. It was much needed and much appreciated. I'll never forget them.